Alright team, we have a patient presenting with rheumatic fever, conjunctivitis, and skip lesion. What do you think is the diagnosis?
Could it be Dietrich's disease?
Doubt it.
I'm leaning towards Takayasu arteritis.
Um,
I think it might be ankylosing spondylitis.
you're not even trying.
I'm considering Regenerative granulomatosis.
No. It's pulmonary artery sling, you basket of bozos. We need to act fast. Prepare for adrenalectomy.
But sir, adrenalectomy is risky. Are you sure about this?
I don't care about the risks. It's the only way to save this patient. Now, get ready to operate. Lives are at stake. Tracy, I really need to perform adrenalectomy on my patient. I believe he has pulmonary artery sling.
Hawks, are you sure about this? Your track record of diagnosing rare conditions is not the best.
Who told you that?
Your own personal file. We track your success-failure ratio.
That probably got vandalized.
Who would do that? And how would they do that?
I'm thinking, Gary, I can never quite trust that guy. As for how, I'd prefer not to discuss how I give away access to the hospital servers to people who aren't authorized.
Oh, just perfect. The patient is in critical condition after the adrenalectomy. This is not looking good, Gary.
I can't believe Dr. Hawks insisted on the adrenalectomy for pulmonary artery sling. It's clear now that it was the wrong treatment.
We need to act fast. What do you think the correct treatment should be in this case?
I'm sure we can come up with a solution. Maybe we can explore surgical options or alternative therapies.
Alternative therapies? Like what?
Maybe a breath of fresh air, a trip to the mall, anywhere but here.
How did we lose the patient? Misdiagnosing pulmonary artery sling and performing an adrenalectomy. Are you all trying to play God without a clue?
We don't play fictional characters, sir. What's your suggestion?
Don't ask me, you bunch of morons. I need to fix your mess first. And don't even get me started on your sloppy surgery skills or your goddamn blasphemy.
Please tell us what we should have done instead. We need to learn from our mistake.
Learn from your mistake. You're lucky I don't report you all to the medical board. I turned my back for 2 hours, and the patient has gone missing.
The patient isn't missing. We're just trying to find them.
We need your guidance, Hawks.
Guidance? You need a brain transplant. Figure it out yourselves. I'll be at lunch trying to salvage what's left of this case.
There's hardly a case without a patient, Hawks. Good luck explaining that one to Tracy.
I'm going downstairs to the cafeteria. When I come back up here, I expect there to be a patient back in that bed, critical or not. So, how are things going over in oncology department, Johnson? Any progress with your patients?
Actually, we've seen some positive responses to the treatments. A few of them are showing signs of improvement, which is always a great thing to see.
That's good to hear. But, I've been mulling over this one case for a while now. It's just so puzzling, I can't seem to crack it.
The mysterious case that's been keeping you up at night. What are the symptoms? Maybe I can help you brainstorm?
Well, it's a combination of neurological and gastrointestinal issues. I believe it's a rare autoimmune disorder that affects both systems. The problem is I can't confirm that because the patient is no longer at the hospital. Gary and Randall took him outside for a few minutes to try stabilizing him, and now no one knows where he is.
I can see why that's a problem. Tracy's not going to be happy about this one.
No, and they're going to blame me for Gary's stupidity. The fact Randall joined in doesn't help either. I figured it out. The pulmonary artery sling diagnosis was wrong.
Hawks, what are you doing here without proper gear? You're putting everyone at risk.
Yeah, you can't just barge in here like that, Hawks. It's against protocol.
I don't have time for that. I solved it during lunch with Dr. Johnson. It's ribose 5 phosphate isomerase deficiency.
Ribose 5 phosphate isomerase deficiency. What's the prognosis for that?
The prognosis is not good. It's a rare genetic disorder with a high mortality rate.
Are you sure about this, Hawks? We need to run more tests before confirming.
Trust me, I'm sure. This is it. We need to act fast to save the patient.
Well, that's great, Hawks, but until we have the patient back, we cannot do anything.
Wait, this isn't the patient on the table?
It's a patient, but not the patient.
Alright, let's pretend this one has ribose 5-phosphate isomerase deficiency. I can't believe I misdiagnosed that patient. Ribose 5-phosphate isomerase deficiency makes so much more sense than pulmonary artery sling.
Congratulations, Hawks. You found the right diagnosis in the end.
If only I had competent doctors to work with, this wouldn't have happened.
What do you mean by that? You were the one who made the initial misdiagnosis.
Well, my team's diagnostics weren't up to par. They should have caught this error sooner.
You can't shift the blame onto your team when you were the one who declared the wrong diagnosis, Hawks.
Honestly, I can. The patient I treated doesn't look like the one that came in here this morning, so it's possible my doctors are lying to me.
What? But this is why I demand that you actually meet with your patients before they are treated. Also, I already know that Gary and Randall lost a patient because they let him outside.
I warned you that I have idiotic doctors. It's probably time we fired Gary.
This one's on you. Yet another addition to your record.
Oh boy, my first missing patient. What's my prize?